Hi everyone, my name is Nick Zupan. I'm the epidemiologist with the Rock County Public Health Department. That means that I look at all the data and try to track the spread of COVID-19 and other infectious diseases in our community. In today's video, I'm going to be talking a little bit about the data that we use to make our decision as we moved from Phase 1 to Phase 2 in the Rock County reopening phased plan. The first two measures that we used for our phased reopening plan include the percent of positive tests and the total number of tests that are being done each day. The reason we chose these two measures is that we want to see increases in testing and also decreases in the number of positive results. As we see testing increase and positive results decrease, that's a good sign that the disease is not spreading across our community very rapidly. The next set of measures that we're using involve the hospital system. So we want to make sure that our hospital systems can test any staff that they have who provide patient care. We want to ensure that there are no staff who are treating patients who could be potentially COVID positive. Additionally, we want to make sure that the hospital systems are not damaged in any way and can adequately care for patients in the appropriate areas. Also, we want to make sure that there are trained staff available to treat any COVID positive patients. And finally, we want to make sure that the hospitals are not lacking any critical status supplies that might help in the treatment of COVID positive patients. And I can inform you that our hospital systems have not reported any of these issues for the last 4 weeks. Another metric that we're using is related to healthcare staff and the number of new cases that are represented by people who work in healthcare settings. Now, this doesn't necessarily mean just hospital workers. This could be staff who work at nursing homes, skilled nursing facilities, or long-term care facilities. I'm happy to report that over the last 2 weeks, we have only had 2 positive COVID-19 patients report that they are healthcare workers. To ensure that the hospitals are not lacking any critical supplies that they might need to treat COVID-19 patients, we're also looking at the percent of beds that are available at these hospitals and the percent of ventilators available. This is an important metric to make sure that we have enough capacity to treat any potential increases in the number of COVID patients who require hospitalization or intensive care. Right now, we're looking at the percent of ICU or intensive care unit beds that are available, the percent of ventilators that are available, and the percent of general medical surgical beds that are available. The next measure that we're looking at relates to contact tracing. Contact tracing involves the health department following up with any people who are potentially exposed to COVID-19. When someone tests positive for COVID-19, we ask them about who they've come into contact while they were in their symptomatic phase or while they had symptoms. Then what we do is we try to follow up on these people as quickly as possible to make sure that anyone who has potential exposure to the illness is protecting themselves and preventing further spread. The measure that we're using in this case is the percent of people who are a known contact of a positive case and how quickly we're following up on them. We're trying to reach everyone within 48 hours, and that's the measure that we're using in our phase reopening dashboard. Finally, we're using information from our healthcare partners about the number of patients that they're seeing who present with COVID-like symptoms. So this includes cough, shortness of breath, fever, and other types of symptoms that are related to COVID-19. Now, this doesn't necessarily mean that these people have been diagnosed with COVID-19 or tested positive, but if we're seeing an uptick in the number of people with COVID-like symptoms, it's likely an indicator that we will see an uptick in the number of positive cases in the near future. We want to get ahead of any type of uptick by taking a look at people who are presenting with these symptoms. So therefore, we're looking at the number of people who have presented to the hospital or their doctor with COVID-like symptoms over the last 14 days. I can report for this measure, we are seeing a decrease in the last 14 days. So that concludes a brief overview of the measures that we're using when we're thinking about a phased approach to reopening Rock County. Remember, you can submit your questions about COVID-19 to the email address listed below on your screen. I appreciate you taking the time to watch this video, and stay safe and healthy.